When we were at our childbirth class, they had said, you know, about a third of you in this room will probably have a C-section. And I'm thinking to myself, oh, stinks to be that girl, because I really had it didn't even occur to me. I mean, my mom had 3 of us regular deliveries. My grandmother, it never occurred to me that I would have a C-section, not even in the farthest realm of my mind. And my first memories of him were being shown up above the curtain, and then obviously the picture, they took him away. And then I got to see him on camera, the pictures that my husband had taken, which I know is a very common experience for some people, but for me, who had been looking forward to experiencing the vaginal delivery, and you're 10 centimeters, it's time to push, and putting the baby on your chest, it was really tough. And I know you're supposed to be happy that you have a wonderful, healthy baby, and I was, but there was still a part of me that just couldn't get past the fact that I didn't get that experience that I wanted.
It feels like we're seeing more and more of those patients who want to have a vaginal delivery after they've had a prior C-section, which I guess is really not surprising because our C-section rate nationally has just increased. So I think as patients just become more aware of it, you know, wanting to understand why they had it or if they can have a different experience this time, we're going to see more and more patients that do that.
I had done a lot of research on VBACs, the pros and cons of VBACs, and I found that most hospitals here in Charleston, South Carolina don't do VBACs or allow VBACs because there is a slight chance of a uterine rupture. And, you know, I wanted to make sure that I was in the safest place possible when we did get pregnant again, because I knew that I did want to try for a VBAC. And we actually met. I found Dr. Malden online after doing my research that she was very pro-VBAC and was specialized in VBAC.
What I think is a benefit here at MUSC is obviously that we have 3 physicians that are on the floor all the time, 24 hours a day, and then we also have anesthesiologists and nurses. So really, if anything was to go awry, then we can respond very quickly.
Friday morning of July 30th, which is also my 2-year-old son's birthday, he turned 2 that day, I woke up in hard labor. A few hours later, I hit 10 centimeters. I was feeling the pressure that all my girlfriends had described that you feel, and they said it was time to push, and I mean, it was so exciting. I have a picture that my husband took. I said, just take a picture because I get to push, and I was so excited to get to that point, and sure enough, probably 3 or 4 contractions, and she was here, and they put her up and put her on my chest, and he was able to cut the cord, which he didn't get to do the first time. And I mean, it was just such an amazing experience to have and be a part of, and the recovery was fabulous. And everything just sort of came full circle for me, and it was wonderful. It really was. They helped me fulfill my dream of having a vaginal delivery. They definitely changed what I thought was possible. If I'd gone the conventional route, you know, I would have had another C-section with my daughter if I did what was the typical standard. And thank goodness for the support of doctors at MUSC who were at least allowing me to try.